So we're going to be talking about the femoral triangle. It is a triangle. Basically, it's just a depression in the upper one third of the thigh. It's located medially and just immediately below the inguinal ligament. Inguinal ligament is shown right here. This one is the inguinal ligament. It starts from the anterior superior iliac spine and ends at the pubic tubercle right here. This is basically the inguinal ligament. So the femoral triangle, the inguinal ligament forms the base of the femoral triangle, where uh, we're talking about the boundaries. So the lateral boundary of the femoral triangle is this one, like this one, yeah. And this muscle, basically this muscle is sartorius, and this is the medial boundary, medial border of the sartorius muscle. So laterally, it's formed by the lateral border of the sartorius muscle, where medial border of the sartorius muscle, and on the medial side, this one, it's this one is the adductor longus muscle. It's formed by the medial border of the adductor longus muscle. Talking about the floor of the triangle, it's formed medially. This one is our lateral side, and this one is the medial side. Medially, it's formed by the adductor longus and pectineus muscle, where laterally it's formed by the iliacus muscle and the tendon of the psoas major muscle. And the roof, it's covered with skin. It's covered with superficial fascia and deep fascia, of course. If we talk about the contents of this, we're just going to enumerate some contents that travel in this triangle. One of them is femoral artery, then it comes femoral vein and femoral nerve. Also, nerve to pectineus arises in the femoral, uh, arises from the femoral nerve, just above the inguinal ligament. Femoral branch of the genitofemoral nerve also occupies the lateral compartment of the femoral sheath. And femoral sheath is it's a sheath that covers 4 centimeters of the 4 centimeter of the vessels, the femoral vessels.